Remember the Andromeda strain? The science fiction virus that struck Earth from outer space, threatening all of humanity. It's easy to fantasize that Ebola or Lassa fever or hantavirus might be such a killer. But what if the Andromeda strain turns out to be real? A mutant strain of a disease we thought we had conquered. What if it costs billions of dollars to contain and forces governments to imprison the infected to try and keep the public safe?
This is a DNA fingerprint pattern of a tuberculosis strain which we've identified, and in New York City this strain has spread since the early 1990s and has infected over 200 people. It's a very, very multi-drug resistant strain.
In a secure Bio-Level 3 lab, hidden in a nondescript building in downtown Manhattan, Dr. Barry Kreisworth and a team of detectives at the Public Health Research Institute fight a small war against one of the most dangerous emerging diseases in the world, multi-drug resistant tuberculosis. 50 years ago, TB was one of the leading killers in the world. It spread through the air from person to person, year in and year out. Healthy immune systems held the infection in check, but for those unlucky people who developed active cases, TB was a slow, agonizing way to die. By the 1950s, improved sanitation and the discovery of effective antibiotics had vanquished the killer. Tuberculosis hung on in poor nations, but with time, everyone expected it to follow the path of smallpox into the dustbin of medical history.
People had predicted back in the 70s that tuberculosis would be completely eradicated from North America by the year 2000. All the indicators had told us that. In the middle 1980s, all of a sudden, all the curves that started having the downtrend were now turning the corner, and we started seeing the rise in tuberculosis. And it hit us in New York because all the factors that you wouldn't want to come together came together. That is, you had poverty, you had crowding, you had hospitals and prisons that weren't aware that you had active cases of TB very closely quartered with HIV-positive infected people.
The depressed immune systems of AIDS patients are unable to fight off disease. They are most vulnerable to active infections. But there is one more part to the witch's brew. Several strains of TB that erupted in New York are resistant to antibiotics. Kreisworth and his team dubbed one of the most vicious the W strain.
We have the multi-drug resistant strains in the United States because we had the drugs to treat people who then became, unfortunately, resistant because of noncompliance. They didn't take their medicine, the bacteria evolved, resistance appeared,